Hi, I'm John Terranzetti, Vice President of Data and Technology Analytics at Carecentrics.
And I'm Krupa Srinivas. I'm with Owned Outcomes. We are a healthcare IT company focused on data analytics and machine learning in service of patient care.
Well, thanks everyone for joining today. We're really excited to be here to talk about how we are leveraging data and analytics to deliver better patient outcomes in the post-acute space. Carecentrics has been around for over 20 years, and our focus is on making the home the center of patient care. We do this by partnering with providers and payers to build and administer programs that help to meet patients' specific clinical needs as they transition from an acute setting back to home. As we have worked to stand up our product over the last few years, one of the things that we've noticed about the post-acute space is that too often decisions are made based on anecdotal or qualitative evidence. As you see on this screen, many of the things that we hear when determining which providers should be a network or which providers should be receiving a certain case are things such as, well, they always answer my phone calls, or I haven't heard any complaints about this provider. And that can't be the way that we administer healthcare in the 21st century. And one of the things that we have identified at Carecentrics as a true opportunity is leveraging data and analytics to figure out which are the right providers to put in our network. Which are the right providers to be delivering care for certain patients based on their specific needs? And what are the specific outcomes that will help us to drive constant feedback conversations with providers so that they can continuously improve their performance?
So let's say we pick a sample market and Carecentrics is looking to establish a brand new network within that market. And we want to look beyond star ratings like John mentioned. We would look at a visual like this. So this crunches all of the numbers from extremely large data sets and provides it in an easily digestible format. So left side indicates the providers, and on the right side, we have the clinical areas. As we look at this picture, if we simply kept in mind that blue indicates good performance and pink indicates poor performance, right off the bat, it's easy to see that when we look at different providers in certain clinical areas, they actually do have good performance, whereas in certain other clinical areas, maybe those are areas of improvement for them. So if we were to pick specific to clinical areas, because we've already established that a 5-star provider doesn't necessarily mean 5-star across the board. If we were to pick cardiology, for example, we see that there are certain providers that do better than others. The standout ones in this case would be SNFs 2, 3, and 5. They have the darkest blue lines. Now, if we said, hey, for legacy reasons, we've always partnered with this particular SNF, SNF 5, because they're 5-star rated, let's just get a sense for what it is they're good at and what it is our clinical folks have to come in and provide clinical pathways and processes to help them improve. The 2 pink lines we see in this picture go to the digestive and other medical clinical areas. So those would be where we work with this provider and help them shore up their processes so that we can drive collectively towards better outcomes. Whereas in cardiology, they're already hitting it out the park, so go ahead and send them cardiology patients all day long. A little bit lower performance than cardiology is respiratory, but still good because they are in the blue. Similarly with orthopedics, they are in the blue. They may not be the best, so we just have to go ahead and systematically look at every single provider in this market before we make those determinations. Let's take another example actually over here of digestive, because this is a stark one. I look at this picture and what we see in this market is for digestive care, even though SNF 1 is only 2-star rated, they're actually the only provider with the blue line. So perhaps they're worth including into the network for the purposes of taking care of our digestive patients. These tools can actually be used, and they are being used today, to not only select a network initially, but also to monitor the performance of the network over time as more and more data becomes available and we're able to study and visualize them. With that, JT, I turn it over to you to provide an example of one of our MA markets.
Thanks so much, Krupa. As Krupa mentioned, the value of this approach is in choosing the right network, helping patients receive care from the right providers, and then using this information to continuously coach and provide feedback to our providers on where they can continue to improve to deliver the best care. And what we're seeing from this comprehensive approach is significant improvement in outcomes and reduction in cost. For example, in this one market that Krupa mentioned, we're seeing a significant savings based on reduced readmissions, reduced time spent in a facility, and improved ability to receive care at home, which translates in many cases to additional time at home with your family and reduced incidence of readmission back to the hospital. So with that, we are very excited to be able to present our approach and our findings to you and look forward to answering your questions. So thank you so much.
We'll see you at the virtual walkthrough. Thank you.